Okay, just shut all these little boxes down. Jenny, you've got your hand up.
Yeah, sorry, Sarah. I noticed that in the chat there's a couple of AI note takers, and I don't know, but in other meetings that's sometimes caused halfway through transcriptions to appear in the chat. I don't know if anybody feels particularly strongly about it, but as this meeting's being recorded, I don't really see a necessity for AI note takers.
I've never seen that before, Jenny. Do you know how to stop it?
I think you can just remove them from the group.
Oh, remove them from the group.
I think if you go to the list of people, you can
Oh, I can see
them.
it. Oh, they're called Karen. Isn't that spooky?
Yeah, I don't. I'm a bit of a laggard when it comes to this. I use Copilot. I think it's really helpful, but I'm not sure about these bots coming into meetings, and bearing in mind that, you know, some of the content may be a bit sensitive, and you do record it anyway. I don't see any necessity myself. I just thought I'd flag it.
No, thank you for that. I didn't realise it was doing that, and I have now removed the AI chatbot, whatever they're called, Karen. That's the first time I've ever removed anybody from a meeting.
I think
Okay,
there's another one
that.
called Team Maestro as well. I think there's 2 of them on today.
Oh, do you mind?
Perhaps it might be something that we need to look into. Do you want me to get rid of them? Yeah.
Oh, it's okay. I've just seen them. Taking out Team Maestro as well. How strange. Okay, we'll sort that out for next time. Okay, so welcome to the Mental Health Action Group for East Sussex. I always like the spring meeting. It's the season of new beginnings, as they say, so it always feels really hopeful. And of course, the sun is out, which it always seems to be for the March Mental Health Action Group. So this is the agenda for today. I pinged out the slides just in case anybody wants to see them, because some of them have got quite a lot of writing, so it's sometimes quite nice to see that on a bigger screen. So I won't run through it, but we are going to have a comfort break when I think is approximately the halfway point. So I think I've put it today just after Jacy's item. So without further ado, I think I will hand over to our first speaker, who's Ian from our team, who's going to give you the latest on the neighbourhood mental health teams. Ian, I'll do the next slide bit.
Wonderful. Thanks, Sarah. Good morning, everyone. I think probably most people know me by now, but in case there's anyone new, my name is Ian Dyer, and I work as a programme manager for East Sussex County Council. I spent quite a lot of time over the last few years supporting the design and implementation of the neighbourhood mental health team model across East Sussex. I'm just going to give some very quick updates around where we are with that programme today. So if we could move on, Sarah, please. Thank you. So I'm sure probably people are sick of hearing me talk about it, to be honest, but just in case there is anyone here that is new and hasn't come across neighbourhood mental health teams before, just a very quick overview. So the neighbourhood mental health team offer is actually been live now since the 8th of December. And it's an offer that's been in the design implementation for quite a number of years, and it's been all based around this idea of trying to create a much more integrated, seamless, one team approach for the delivery of community mental health services for people across Sussex. That's East Sussex, West Sussex, and Brighton and Hove. But the name gives it away. It's a neighbourhood mental health team, so all the teams are based very locally across each of those 3 places. So I've been working on the East Sussex delivery, and in East Sussex we've had 5 neighbourhood teams created that cover the same areas as our district and borough boundary areas, which also align with our new integrated community teams. So it's a reasonably new offer. It's only been live properly since November, December time, and it's all about bringing together existing offers of community mental health care that have already been there, trying to make them work together much more effectively, much more seamlessly, to make it easier for people to access and navigate mental health services when they need them in the community. So if we could move on, Sarah. So just very quickly, since we last met in December, I just thought I'd give some updates around what's happened since. I think last time I talked about the fact that the teams had already gone live, but that they weren't able to use the single shared system. There's always been a plan that the NMHT offers, which are bringing together people from Southdown and the NHS and primary care, to be working together. So crossing organisational boundaries, there was always a plan that they would eventually be using the same patient record system to record all their activity, making information sharing much easier, making reducing duplication for staff and for individuals using services as well. Really happy to say that that's now happened, that we do have all our NMHT core staff using System 1. It hasn't been a process that's been without hiccups, but it has nonetheless happened. Staff are using the system and getting to grips with it, and really moving towards this point of having a single care plan, a single risk assessment, all those really really helpful practical things that are going to make it much more much easier to deliver and receive services. So that's great. I think that's really good news, and yeah, really happy to be updating you on that one. People that have been part of the historic community transformation partnership group in East Sussex hopefully would have received an email from me a few weeks ago talking about our decision to stand that group down. It's been a stakeholder reference group that we've had in place for the duration of the programme delivery, which has all been about trying to get as many stakeholders engaged in, involved in, aware of the programme. As we're now moving to more of a business as usual position for the programme, the design work has all been completed. For other reasons around capacity and all sorts, we thought it's going to be better to use other existing spaces such as the mental health action group, but also the mental health network that's still going to be in place for the next 12 months, and the Sussex-wide webinars and places like that for people to be able to go and get their updates around the NMHT programme. So in East Sussex, our transformation partnership group has been stood down, but there's still plenty of opportunity to stay up to date with what's going on. Another development there, so we have started in East Sussex, and this is just an East Sussex piece of work that we've focused on because we thought there's a really strong need for it here, is to be looking at how our neighbourhood mental health teams can really be strengthening the offer that they provide to people. And sorry, I shouldn't have used that acronym. I might try and change that, Sarah, when we send it around. So COSHM there stands for co-occurring substance misuse and mental health needs. So historically, people that have struggled with substance misuse issues as well as having mental health needs have often found it much harder to access mental health services as a result. There's not really been a hard and fast reason why they should, and there's been policies and maybe some elements of misunderstanding at times around what is effective, how effective mental health care can be for people when substance misuse is a part of their experience as well. Really happy to say that we're trying very hard across the system to move away from that approach, and we've developed a specific subgroup in East Sussex to really look at that issue of how can we make sure that all these new learning, all this new policy approaches from different organisations can be factored into the NMHT offer, and I think that's a piece of work that's going really well. Moving forward, so there have been some changes to the programme team. People may be used to Martin, Domini and Andrea Potter having had quite a lot of input into the programme and coming to these sorts of spaces from a VCSE transformation point of view. They've moved on from their roles. There might be some opportunity to have someone else come in and take up some of that work for the next 6 months, but that's still being worked through at the minute. People will probably be aware that the Integrated Care Board is going through a very significant restructure and reduction of staff, and they have been an organisation that have from the start been very well involved in the programme development, and with the departure of some of their colleagues, it's really meaning that the way that we're delivering the programme over the next 12 months or so we've really had to think about what can actually be delivered now with a smaller programme team right away across Sussex, and that really feeds into this idea of the last bullet point there. We're thinking about what is our model development plan going to look like for the financial year we're about to enter, so 26-27. Because although we know neighbourhood teams are there, they're functioning, they're still a fragile new offer, we didn't really see the launch as being the end. Actually, we saw it more as the beginning of a development of a completely new way of doing things. So we still know there's plenty more to do to really get our community mental health services where everybody wants them to be. So with that in mind, if we move to the next slide, please, Sarah. This is just some of the work that we are wanting to do over the coming 12 months. It is going to depend a little bit on the amount of resources that get dedicated to the programme. There's still lots of conversations going on about that, and we hope to be in a place of having a bit more certainty around what those resources might look like within the next week or so. But what we know would really make a difference to really strengthen the offer is to have what we call our primary care and partnerships function within each neighbourhood team really embedded. That will be happening by the end of March. So that means that we'll have some staff that have been based in GP surgeries, historically called the emotional wellbeing services, and staff that have historically been embedded within the Health in Mind offer. Will be being integrated into the neighbourhood teams and under neighbourhood team management structures, so really strengthening that primary care part of the offer, where people can just essentially refer themselves for support. So that will be happening by the end of March. There's no real doubt about that. So the rest of it is stuff that we really want to try and make sure that we can get done. Whether we'll get it all done in 12 months will depend on the resources. So we need to make sure that we're very clear around what our clinical and non-clinical offers within the NMHT is going to be. That's work that we were hoping to have completed, but that got impacted by a lot of staff sickness. So that will carry on through the next 12 months. We would want to make sure that we can properly evaluate the offer at a really high and really granular level to really make sure that it is doing what we want it to be doing across the system for our residents and our staff. We want to build more on what people have heard a lot about, I'm sure, this aligned service offer, so really making sure that we're not just talking about a very small group of teams that are part of this offer, that we're making it as far and wide and encompassing as it possibly can be, and as encompassing as it needs to be to make sure we're delivering holistic offers of care for people. We want in East Sussex particularly to explore as much as we can any opportunities to provide a more open access offer of mental health services. So what we are in some level of discussion, and I think, is it maybe Stuart that's talking about the redesign work in a moment, he might pick on us a bit, is that there's work around the Southdown wellbeing service being redesigned, and we really want to see if there's any opportunities to provide access for people for clinical services through some of these more community-based offers. We'd really like to see that happen. And we are still working on making sure that we really get the service user voice fully embedded in the service delivery element. They've been very well embedded in the programme and design part of it, but we really want to make sure that that service user involvement remains front and centre of everything that gets delivered for the NMHT offer. Comms continues as always. We've got a dedicated comms lead across Sussex with Megan, who's great, and there's lots of information around comms and NMHTs in general on the webpage there. So that is me for now. I'm more than happy to come back and keep people updated. There's some information there around how to be involved in the mental health network that I mentioned about. There's the monthly webinars and newsletters that you can sign up for if you want to keep in touch as well, if you're not already. Yeah, and loads of information on the SPFT page and the integrated care system page if you're interested. Happy to take any questions, Sarah, if we've got time.
Lovely. Yeah, we've got a couple of minutes if anybody's got any questions, and I'm sure Ian doesn't mind people contacting him directly either.
No.
But yeah, any questions at all? And that's the case. If you think of anything throughout the meeting, just pop it into the chat. Okay. Well, these first two items are very much linked together, if you like. So I'm going to hand over to Stuart, who stepped in for Rebecca. Anyway, you can explain that, but you're obviously very much involved as our partnership lead in East Sussex to talk about the redesign of some of the Southdown mental health services in the community. Stuart.
Thank you. Thanks, Sarah, and thanks, Ian. Yeah, so I'm Stuart Reed, the partnership lead for UOK Sussex, which is the lead partner element of Southdown that is delivering the mental health support services contract in East Sussex. Yeah, apologies from Rebecca Barkaway, who is leading the redesign. I think she's previously been to the MAG before, but I'll do my best to stand in for her. So yeah, I'll just run through where we are at the moment. So next slide, please, Sarah. So you will have seen this before if you've been to the previous mental health action group meetings, but the vision for the mental health support through the new wellbeing service is something that Ian talked about as well, that we really do want to see changes, and we do want to see services that are much easier to access and to support people to get services sooner. And where they are. So at the moment, to access a lot of the current South Down mental health services through the wellbeing centres, for example, there's a referral process and an assessment process, and there's wait times between each of those points. So we very much wanted to get rid of that, and so to make access for people much more easy, and when they want it, and also where they want it. We believe strongly that mental health services should be welcoming and inclusive for everyone, and this is obviously a challenge in a big county, in a geographically big county like East Sussex. That there are currently areas where there isn't provision, and whilst we know that we cannot provide services in every single village and every single community in East Sussex, we at least want to bring those services nearer to people and more easily accessible. And then when they do come, it should be services that feel relevant for anyone, no matter where they are on their wellbeing journey, and have their wellbeing needs met. Like Ian said, around the neighbourhood mental health teams being organised around those districts and boroughs that we have in East Sussex, which also aligns with, as Ian said, the integrated community teams and the integrated neighbourhood teams. These services will also be organised by the neighbourhoods, so the 5 districts and boroughs across East Sussex. And they'll also work very closely with those teams, with those neighbourhood mental health teams. They've been very involved all the way through. South Down have in the development of the neighbourhood mental health teams, and a lot of the redesign process has very much had the services that are being delivered by the mental health teams at the forefront of thinking when the redesign has been taking place. Also, services should be easy to understand. They should be easy to navigate. They should be clear. It's clear what they do. So trying to remove some of that mystery maybe around what services are and what goes on in buildings. So making that much more transparent and easy to navigate ultimately. And also, we very much recognise that there isn't any new money coming in, and obviously with rising employment costs, this means that we're having to deliver services for less money. And what we want to do, what the ambition is to do, is to deliver more services. And so we have to come up with a model that is innovative and flexible, and makes the best use of the resources that we have. So yeah, very much we hope this is a sustainable model. So next slide, please, Sarah. So yeah, as I say, they're based around those neighbourhoods. You're obviously with South Down delivering services in both East Sussex and in Brighton and Hove as the lead provider, and also delivering other related services. The redesign very much was across both of those areas. So you'll see here the 5 districts in East Sussex, but also the ones in Brighton and Hove as well. One of the big innovations in this model, and something that we feel is absolutely crucial, is the introduction of 4 neighbourhood leads. So these roles will be there. So neighbourhoods will have a designated lead, and this person will be responsible for a lot of the coordination of the services, a lot of the partnership working. So making sure that we are really aligned with the neighbourhood mental health teams, but really importantly as well, making those connections with the local VCSE sector organisations as well, to ensuring that we get maximum benefit from, and that people who use the service get maximum benefit from the most services that are available, because we understand that there are a lot of really good services providing vital support and well-being, and we want to make sure that we're connected to those, and the neighbourhood lead in each of those areas will be really, really crucial to making that happen. And also the fact that services, there might be stuff going on in one area that isn't the area that you live in, but you like the look of, and people can move between those neighbourhoods. So if you live in a part of the Lewis neighbourhood, that there's something going on in Hailsham or somewhere in the Wealdon district or any of the other districts that you really want to go to, and you can, that's absolutely fine. People can move freely between those neighbourhoods. So moving on, please, Sarah. So spot the deliberate mistake on this slide. So what's available in each neighbourhood? So there'll be facilitated peer support groups. So these will be groups that are set up around particular interests or particular demographics, and these will exist in each of the neighbourhoods, and they will happen. Several of those will happen a week, and anybody will be able to go along to those peer support groups. There'll also be a social space, and this social space is something that has been developed very much from feedback with current service users around wanting to have that continuity of service that they currently get, and also for people who might not feel that other elements of the service, like the peer support groups or like education and learning, doesn't quite fit for them. So these social spaces will continue in each of the different neighbourhoods. Some of them might have themes if there are emerging themes that people want to do. So it will be very much reflected in possibly what people are doing at the moment. But each neighbourhood will be running these social spaces. There's also, I'll talk a bit about this later on, but also that won't only be open to existing clients. It was felt very much by existing clients that actually it should be open to new clients as well. So these particular spaces should be available. We're also going to have welcome sessions. So these are those open access sessions that anyone can turn up to. These are already happening. Managed to implement these quite early on in the redevelopment of the services. So I think these have been going in each of the neighbourhoods since October. We will increase those, and there will be several of those sessions across the week in each neighbourhood. And these are very much open sessions that anyone can turn up to without an appointment, without the need to be referred. Just walk in and start getting support and signposting and advice and guidance straight away when they want it. And hopefully, as we develop, these welcome sessions will spread further into different communities across East Sussex. One-to-one support will also be available. So within those welcome sessions, it will be possible to either see a mental health support coordinator there and then, or make an appointment to see someone who will help you understand what you want and the types of services that are out there that might be of interest, and signpost to those. And there'll also be elements, really importantly, of social prescribing in those support sessions as well. We really want to deliver education and learning, so psychoeducational courses, and linking up with current providers of those, like the Recovery College, but also thinking about how we can develop more education and learning for people who want that. There's the deliberate mistake. There's another social space to just demonstrate how many of them there's going to be, and also there will be crisis support. So obviously we have Staying Well existing within the South Down offer that will continue as it is, but also people who do find themselves in crisis and do contact the service will be supported to access and be signposted to the relevant support that is required. So yeah, moving on, please, Sarah. So where is support going to happen? Where is all this going to take place? Well, we still have all of our the wellbeing centres, so 7 wellbeing centres across East Sussex, and those will be rebadged. They will be called something like, although I don't think this is completely set in stone, but something like wellbeing hubs, neighbourhood wellbeing hubs, something like that. And these, as I say, will become buildings that we very much want to be used a lot, including in the evenings and weekends. And we are very much hoping that there will be other organisations who provide services who might be looking for premises, or might be providing services in one area and want to do it in another area, to use these buildings. So very much inviting the VCSE network to come in and use these hubs, and for them to be real places that are lively and there's stuff going on a lot of the time. And the neighbourhood leads that I mentioned, those roles will be very much coordinating that and encouraging that to happen. Pop-up sessions, not completely convinced by the term pop-up sessions, but we're trying to think of something that might be more relevant. We want to be delivering things in community venues, and this is the way that we can deliver services to other parts of the county that we're not currently delivering services, or we currently don't have property and buildings. So they could be local libraries, they could be local leisure centres, or they could be cafes, or they could be other buildings that are used by other community groups as well, village halls or whatever. And again, that will be down to those neighbourhood leads to start making those inroads into different community venues. So very much seeing wellbeing actually coming out, wellbeing service and wellbeing provision coming out of mental health buildings or places that have been used for mental health delivery, but very much in the community and more visible. So next slide, please, Sara. So how people will access and move through support. So very much those open access and welcome sessions that Ian mentioned that are already happening. That will be a really easy way for people to access the services quickly. There is also going to be a telephone number as well, and I'll tell you a bit about some other ways of accessing via telephone in a couple of slides time, but yeah, those sessions are happening already, and we want to only increase those. So increase the visibility, but also increase the opportunity for people to access via that. One-to-one support and coordination. So when people do come and they're connected in with a mental health support coordinator and our workers in the centres, they'll be coordinated. They'll be signposted, and that support will be coordinated on an individual basis. People will be able to access those groups, those peer support groups. We will only see those peer support groups grow as we move through the transition phase and the service becomes more embedded and more peer support groups grow. We're also hoping to utilise volunteers a lot more, so we'll be able to see our workforce strengthen through that. There is the social safe spaces, and yeah, the different peer support elements, and also working with partners and specialist services. So as Ian said about people accessing making services more open access, also people who might be using other mental health services, that some of the stuff that's going on in the wellbeing service, some of those groups or peer support sessions might be more appropriate for people. So working really closely with partners and more specialist service providers. So next slide, please. So yeah, the referral routes. So for a start, you don't need a referral. Self-referral is absolutely fine. So there's those walk-in sessions that people can attend in the neighbourhood to just come in and talk about what you need. And then the telephone sessions, we've introduced a way that for people who don't want to walk in or don't feel confident enough to be able to take that step to actually walk in and start talking to someone, or basically someone who just can't make it. You know, they've got other commitments during the time of the walk-in sessions. And by the way, the walk-in sessions will be at various times in the week. They won't just be during the day, Monday to Friday. They will be at various times. But if people prefer to do this by telephone, then they can do that and have a telephone appointment on a Saturday. And if people want to do that, they can book that through the website if unable or not wanting to attend in person. But then people can still be referred, so people can still go through that route of their GP or other health professional. That if they prefer that their referral to be arranged that way. Some people like to know, like services to know that they're going to be turning up, and they like to be referred. That's absolutely fine as well. So yeah, that's another referral route in. So next slide, please, Sara. So we've been going through quite a period of consultation, both with staff and current service users. There was also some consultation done with people who aren't currently using services, and we've had a website that has been up where people have been able to give feedback directly, and some of the refinements that have been made following the feedback is that people wanted more of the social space sessions, so we've incorporated more of those particular sessions in each neighbourhood each week. There will be, people feel there should be a transition period, which is really sensible, that, you know, we shouldn't close the doors on March 31st and open on April 1st and everything's changed. So things will obviously go through a transition period, and we've agreed a 12-week transition period that this will happen. So things won't just happen overnight to people. The social spaces will be shaped by local needs. So if there are more people in a certain area that feel that this is needed more, then we'll do that. And if it's less in other areas, then we will also respond to that. It won't be just one size fits all. It will be very different across the neighbourhoods, dependent on local need and what people want. Yeah, as I mentioned before, there'll be a clear route into the social space for new clients. So there won't be a case of them and us, old clients and new clients, that people will so all aspects of the service will be open to everybody, whether you've been using a wellbeing centre before or you're just turning up for the first time and you feel that social space is the most relevant thing for you, then that's absolutely fine. People will ask for a stronger structure and safety in peer support groups. They felt that it needed that more structure, so the team are working to develop that and to make sure that we do have that stronger structure. We're also going to look at our group length, and review that, because initially we thought maybe we would do like a fixed group of maybe 8 weeks or 12-week groups, and it would start and then it would end and then another one would begin. They still will. I can't see them going on forever, but actually we will review that it won't be like some groups. It might be better that they're longer, and some groups it might be better that they run for a shorter period of time. So we'll keep on reviewing that as we go. We're trying to, where possible, retain the access times that we've got at the moment for people. So quite a lot of our current service users, they kind of, you know, they've incorporated their use of wellbeing centres into their week, and so they come on a Monday afternoon, and that's what they do because they're doing other things during the week, and we really want to encourage that to keep happening. So where possible, we've tried to retain those familiar access times for those social spaces, and also for peer support groups as well. So people who do particular things at a particular time, so it won't be completely a complete change for people. So wherever possible, we try to keep those times, and then also we just want to make sure that our communication around what is happening is really clear, and that it's obvious what we're doing. It's very conceptual at the moment because it's not happening, but absolutely it's really important that we keep on communicating what is happening, what is going on in the services, because there will be new groups and new things being developed all the time. So we need to make sure that is communicated really clearly. Thanks, Sarah. I think, yeah, that's the final slide. So that's the website that I talked about, that's got all of the information that I've spoken about. So mhredesign.org. It's a website that is specifically for this piece of work. There's also a frequently asked questions page on that as well. And that was the website that we did use when we were in the consultation phase for getting all the feedback. But obviously now that's now closed, but all the information is there. And that's it. Thank you very much for listening.
That was brilliant and really comprehensive. Thank you so much, Stuart. And I hope people feel that, well, I certainly feel that every effort has been made to include people's feedback. It's really good to see that, you know, you've taken the views of people who are long-term users who may have enduring severe mental illness, but also it feels like it should be accessible to anybody, whatever their need, with lots of different ways in, which is really new and dynamic. It's yeah, I think it's really exciting. So has anyone got any questions for Stuart? We've got a minute or two. Okay, everyone's very shy today. If you want to link up with Stuart, you'll have his details. Stuart and Rebecca are leading on that change. And yeah, we basically want to draw in partners, not just for the neighbourhood mental health teams, but for this piece in terms of neighbourhood hubs. And as those new lead people coming on board, there'll be more opportunities to sort of become joined up. Jan.
Hello, Stuart. It's me.
Hi, Jan.
I just wonder if you've got any more development news on Rye and surrounding villages.
So yeah, you've reminded me of something as well, Jan. So yeah, absolutely, certainly Rye and rural Rother has been a key area that we really do recognise that there haven't been the services there previously provided under this contract, and absolutely an area that we do want to get in on. That yes, so to answer your question, yes, there has been some thinking about that, and certainly the neighbourhood lead. I'll be working very closely with neighbourhood leads, and certainly I will be signposting that area of the county is a real area, as well as North Wealdon, I think, as well. But a real area where there haven't been the services, so we really do want to get some services up and running there quickly. And we'll be contacting you, Jan, obviously, I think, to look at how we can do that. But also, one thing I did want to mention, it's quite an important thing that but I haven't got a slide on it, is that there will be a small grants fund that we will be developing over the next quarter, and we want to do it as soon as possible. And we've been working with Sara and Kenny to make this available. But this is part of the the contract, that there will be a small grant fund that is for the VCSE sector to be delivering services in their area. I can't give any more details at the moment, but just to say that it is coming.
Lovely. You know how passionate I am about it, Stuart. So
Yeah, no, absolutely.
the phone, if I can do anything to help you along, you know that I always will.
Absolutely, yeah. I think one of the first things, as soon as we've got the Rother neighbourhood lead in place, I think one of the first things we'll be doing is coming over and meeting with you, Jan.
Lovely. Thank you very much, Stuart. Thank you.
Brilliant. Thank you, Jan. There's a question in the chat from Dan about people with sensory needs. I think we can kind of have a chat about that out of the meeting, Stuart, because yes, I'm sure you'd agree that it would be a good idea to link up with those groups, that we can do that through the council.
Yeah, most definitely. And I think it's really important to emphasise that this service is for everybody, that we want a wellbeing service for everybody, no matter what their diagnosis is around mental health or physical health or or other health needs. That we do want this to be a service for everybody's wellbeing.
Yeah, absolutely. One quick question from Mark. Mark.
Hi, Stuart. Thanks for that. When do you envisage that these leads will be in this post?
So my understanding, so they're being recruited now. So I think we're talking weeks. So yeah, so certainly as soon as possible. I think one of them has already been recruited for one of the areas in East Sussex, and the others I believe we're at the point of shortlisting. So funny enough, I messaged the manager from the service who's dealing with that. I messaged her this morning to ask that question myself, and I don't think, let me just check. I don't think she's got back to me yet, but yeah, that was one thing. No, she hasn't. So yeah, but it's in process. But it's a really key role. These neighbourhood leads, so we're looking to get those in place as soon as possible. But if there is anything that you think of in the meantime, then please do contact me, because I'll be working really closely with these neighbourhood leads, and already I'm kind of building up a list for each one of them of people to see, places to go, things to do. So yeah, do let me know.
No, it'd be good to find the lead for our area, and to link in with them, invite them to a team meeting, have a chat and things. That would be good.
Absolutely. And in the meantime, there will be managers in the service as well. So yeah, do drop me an email, because it might be that we don't have to wait for the neighbourhood lead, but we could get either myself or one of the other managers to come along to team meeting.
Okay, thank you.
Brilliant. Thank you. I'm going to have to move us on now, just to make sure we've got time for everybody. But thanks so much for that, Stuart. Really good. Everybody, get in touch with Stuart, and things will start, I'm sure, really beginning to pick up momentum in the next few months. Okay, I'm going to stop sharing my screen, because James, you were going to present your slides.
I was, yes, if that's all right.
So I will do that.
Bear with me.
So I'll fill in a little bit.
Yeah, sorry.
James, no worries. So James has come to present about changing futures, and you possibly are aware that that's actually coming to an end. But there is quite a strong legacy, and James is just going to talk through, hopefully in 10 minutes, James, or within 10 minutes, just about what he's been doing. And I think you said you're going to be around till June, thankfully.
Yeah. Yeah, sorry, just having a few technical difficulties as always.
No
Always
worries.
goes well before the day. Here we go. You all see that?
It's just appearing. Yeah.
Yeah, brilliant. Lovely. Hi, everyone. Well, thank you very much for inviting me along today, Sarah. My name's James Morton, and so I work within the Changing Futures programme, which is a Sussex-wide programme. So just to give you a bit of an overview, as Sarah's already mentioned, we are sort of coming to a bit of an end at the moment, but I'll explain a little bit more about sort of the next sort of phase of supporting people with multiple compound needs in Sussex. So just to give you a bit of a background of the programme, so it's basically, it's a research programme into how services can be designed and delivered, and also commissioned to sort of like support people with multiple compound needs. Now, some of you might have heard various different terms: multiple disadvantage, multiple compound needs, multiple complex needs, and obviously we're talking about individuals and not labels, but just from a technical perspective, in Sussex we tend to talk about multiple compound needs, and so that's individuals who may have a combination of 3 or more needs, such as homelessness, substance misuse, experience of domestic violence, mental health, and also experience with criminal justice system. So the programme, just give you a bit of background on the programme. So the programme is actually funded through the Ministry of Housing, Communities and Local Government, and also the National Lottery. The programme's actually been in place in Sussex since April 2022. Now, it was supposed to finish last year, but we managed to secure another year's funding, which means that the programme is actually coming to an end in about 11 days. Sorry, I shouldn't be flippant about that. I mean, there is a plan for the future as well, but we're very much at the end of it. And so really the aim of the programme is really about creating change for individuals, those who are experiencing multiple compound needs, but also how we sort of can influence services and systems really to have a focus on people experiencing the multiple compound needs, and sort of really embed that within sort of services, but also within the agenda for commissioners, etc. So this very busy slide, I'll just give you a very brief overview of our governance structure, I think just to show you sort of some of our principles and how we work. So in terms of the programme, so we've got 3 multiple disciplinary teams working across all three areas of Sussex. Obviously, I work with the Sussex MDT. I sit with them, and we also sort of work together, get a lot of learning. And the way in which the programme's governed is that we have all 3 places have a multiple compound needs board. I think we're quite proud within the programme that you know, we've actually been able to embed sort of like a really sort of robust governance structure for multiple compound needs, and sort of really push it up the agenda. So in East Sussex we have a multiple compound needs board. We report into that board, and as you can see, we've got those learning loops there, which is in terms of, you know, we feed the learning from the programme into the board, and the board provide us with direction. We're really fortunate in East Sussex that the board is chaired by Darryl Gale, the Director for Public Health of East Sussex. So we're really appreciative of that, and we have colleagues from housing, mental health teams, South Downs, for example. We've got Ra from South Downs, who are part of that board. So really just talking a bit about some of the programme governance and the structure. So really in terms of how we sort of embed change in our vehicles for system change, we've got 2 networks, which is which we coordinate. So one's a trauma-informed network and the other one's a commissioning network. And so part of the work we've been doing is as part of sort of like delivering and supporting for people with multiple compound needs is really embedding sort of like that on the agenda. And so one example around the trauma-informed network, which is led by our lead for systems change, is that we're in partnership with SPFT, we developed a Sussex-wide trauma-informed framework, which is being rolled out across organisations in Sussex, and also embedding trauma-informed training within systems. We then report into an executive group, so that's programme staff with leadership across all 3 local authorities, and then our strategic sponsors group. So our sort of main strategic sponsor is the Police and Crime Commissioner. And then in terms of our pillars about how we work, we host and sort of coordinate a stakeholders and partners network. So that meets monthly, and we report oversight of the programme delivery, also highlight developments, successes and challenges, and then also the lived experience network. This is a really, really important part of the work we do. So we employ or we work with experts by experience, so that's people obviously with lived experience, and so it's really a collaboration of those people with lived experience and organisations, and it's really been really beneficial, we hope, to working across the wider system. So the lived experience network is often used to be consulted on various different projects and work streams. So some of the examples I can give you is quite recently experts by experience were sought for the strategic development into the input for the Hastings Borough Council housing strategy, and also more recently East Sussex County Council have opened up commissioned, and it opened up in November, a specialist women's refuge for women with multiple compound needs. We think it's the only one in the country, and so the lived experience network were very implicit in sort of the design of that, and obviously people with experience of domestic abuse were able to really guide the planning of that actual design of the building. So we work across 6 system change goals. So the first one's really around service transformation. So it's really strengthening the evidence base to improve outcomes, prevention and cost and demand reduction. So in terms of what I mean by that sounds very technical. It's really about how our services respond to people experiencing multiple compound needs, and also, you know, just in terms of how we support them planning at each place in terms of that delivery. Then in terms of our partnerships and governance, in terms of our goals, is really to influence, as I've mentioned before, the structures and programs within Sussex, but also make sure through our commissioning networks we're able to influence commissioning decisions. And then data improvement is also one of our system change goals. So really interestingly, there's no single data set to be able to sort of like identify people who are experiencing multiple compound needs. So it's really sort of quite challenging to a certain extent to understand the population. Fortunately, what's happened last year was that East Sussex County Council Public Health did actually complete a health needs assessment around multiple compound needs, which was published back in July last year, which gave a really good sort of like overview of sort of the individuals experiencing multiple compound needs, you know, where they lived, and sort of the numbers of individuals, which, as usually happens, was a lot higher than which was initially considered. And then we also, in terms of our system change goals, I've already spoken a bit about lived experience, but that's really at the heart of what we do. Is we have experts by experience as part of the lived experience network. All 3 of our multidisciplinary teams have peer navigators with lived experience. And for somebody who's knocked around social health and social care for many, many years and been parts of multidisciplinary teams, I have to say the what that people with lived experience bring to that MDT is just so unique and special, and really in terms of that engagement and sort of sustaining people to be engaged in services and which they might have lost a lot of faith in. We also have developed sort of workforce development. So as I've mentioned, we've developed a trauma-informed strategy. We support networks and training around trauma-informed practice. So we do a lot of work around that, but also we very much share our learning around how we work as multidisciplinary teams across the 3 places. So all 3 teams are slightly different based on their population needs. We certainly see within multidisciplinary teams a very sort of like flexible way naturally of working with people based on how they're sort of how they are on the day, for example, or how they're progressing through the program. And then our other goal is around continuous learning and development. So we are a research and learning program as much as we are there, most importantly, to support people to to improve their lives. We do a lot of work around what we call, it's termed on this slide as swim lanes, but we actually call it journey mapping. So obviously it's with consent of the individual. We sort of work and look at how they were before they came into Changing Futures, some of the work which is done during Changing Futures, and hopefully the benefits that's had, and really sort of in terms of, we got some really sort of strong stories of how people have sort of like engaged within the program, and which has improved their outcomes and sort of general well-being and life. Just a bit of an overview of the East Sussex team. So this is the East Sussex multidisciplinary team. It's a very busy slide. Apologies, lots of busy slides to try and get through in a very short space of time. So I'll canter through this one. So with all 3 MDTs, they're all hosted by the local authority. So the local authority are the host organisations. So what you'll see here in yellow is our local authority colleagues. So at the moment, we report into the mental health services, which is led by Bev Hull. We have an operational manager, and we also have a practice manager who takes overall responsibility for the MDT. In terms of the makeup of our multidisciplinary team, if we start over from the left-hand side, we have a team of peer navigators in the pink. So we've got 3 peer navigators. I think we've got a vacancy there, and a lead peer navigator, and that's provided by an organisation called Emerging Futures. We also have in the red senior substance misuse recovery workers. So we work with CGL, so we have their workers there, and we also have a general nurse, Roger, who is he's employed by SPFT. He is a general nurse, but we obviously have the benefit of being linked into the Mental Health Trust. And then we have on the right hand side, and this is our most sort of recent partners who have come to work within the MDT. We've got in purple, we've got our Interventions Alliance domestic abuse support workers. That's been a real development over the last year, because they also support clients who are in the MCN refuge as well as in the community as well. And so so the Changing Futures MDT is sort of like the main point of referral for both community support and also people being delivered in the refuge. The green bits at the top is the programme team. So I'm there as a project delivery officer, reporting into a deputy programme manager, and then we also have our systems change leads, etc. So that's a bit about our team.
So sorry to be rude. Can I give you a 2-minute warning? Is that okay?
Yeah, of course. Yeah.
Thank
you. In terms of our client profile, I won't go into huge detail about this, but one of the interesting things in Sussex is that actually our typical client is a white British female who's aged around about 42. In Sussex, in East Sussex, the average client tends to be a male aged around sort of 46, and we have been offering more. So we do have sort of like a higher cohort of women within the program, and we think that's because historically and also now we had a project called the Oasis Women's Project previously, and we also have Interventions Alliance now, so we really have that ability to support women. Moving on to the next slide. So what we see in terms of our presenting needs is that substance misuse and mental health tend to be the most prevalent presenting needs for our cohorts. I won't get into huge detail about that slide, but it really gives sort of like a bit of an overview of the various sort of different compound needs and, you know, what our clients are experiencing most, which as I say is mental health and substance misuse. Very relevant for this particular group. And then also just here is lots of busy slides around the combination of needs. So what we do tend to see is for our clients in terms of the combination of needs they have is mainly substance misuse, mental health, homelessness and domestic abuse, which is sort of like the 4 needs we see most prevalently within our client group. So I am cantering through this. So I think the most important thing is I've got a slide there. Does that look blank? I'll move on to the, oh, there we go. So this is just around our how we've supported clients in terms of secured sort of reduced stress and anxiety, stable and secure housing, improvements of engagement, and clients showing reduced intentional self-harm and also reduced risk for clients. So I'm whizzing through this. So the important bit, the future. So in terms of the programme formally comes to an end at the end of this month. However, there's been a lot of work going on in the background, and we're really, really pleased that only in the last couple of weeks, the East Sussex County Council Director of Management team have supported a proposal to develop an integrated multidisciplinary team for people living with multiple compound needs. So that's going to bring together the Changing Futures MDT, but also the Rough Sleepers Prevention and Recovery Service. And so that what that'll mean, it'll be a much more robust team with more additional mental health support, clinical resources, and it will come under the management of adult social care. So this is very new news, and work is now underway to coordinate an implementation plan, and it will hopefully be a strong legacy for the Changing Futures service after March 26. And just very quickly, that we also have got a final event, which I think a few of you might be coming along to on the 26th of March, really showcasing the programme, launching our final reports, and obviously hearing about the next phase of work after Changing Futures. And there's a bit more information there for you all. Thank you.
Lovely. Thank you so much, James. I think it sounds like we should have you back at the next one where we can perhaps, or a separate meeting even, we can just make sure, I think we need to make sure that we're all linked in mental health and what you're doing with people with complex multiple needs. So thank you very much for that. I'm going to just share my screen again. Hopefully it'll go smoothly. There we go. So up next, we've got Jacy talking about men's health. Are you there, Jacy?
Hello, thank you, Sarah. Thank you for having me.
Thank you.
I just thought it'd be quick to give you a quick update on what's happening with the men's health and wellbeing in East Sussex. So it's been funded for 3 years, following on from the Mr. Hastings St Leonard's project that happened within Hastings. So this has been funded to sort of scale across new areas in East Sussex, and it's hosted by Hastings Voluntary Action. So I'm the community development worker that's carrying on, and we have a new manager, Lindsay Scotcher, and obviously we're working with the local men that we have been working with in Hastings as well. And we're collaborating with Rother Voluntary Action because we're going over to Bexhill and Sidley, and the key thing is we're led by local men, and our initial areas that we're focusing on is Bexhill and Sidley because they're kind of like our immediate neighbours. So we thought we'd start there and see what happens. So that's kind of where we are. Can I have the next slide, please, Sarah? So basically, we're based on an asset-based community development approach, and this is really key to how we work with our communities. So this is really based on strengths within our communities. It's really key about building those relationships and it's place driven. So it's quite interesting to see what differences, learning that comes across from what we've done in Hastings to what comes up in the new areas. Principles of collaboration, co-production from the start. I think it's really important to build that collaborative relationships and co-produce from the very beginning, because that kind of instills that ownership, and this is you know, the men's project, and that they are steering the direction. So yeah, so the frameworks, we worked a lot on frameworks in the background, so that we're ensuring community ownership and participation as we go along. And we're really interested in that shift from participation to ownership. So when do the men, you know, they might start coming to some sessions, but then when is it that they start saying, well, actually, I feel that we, you know, we can take this further ourselves. So it is that shift from being looked after to actually we can support our own communities. And so we've been modelling and sharing the best practice from previous learning. However, we're not cutting and pasting what we've done in Hastings to other areas. It's very much about using that approach, but actually seeing what comes to us. So we're welcoming new ideas, and you know, we're not very much, yeah, we are looking for new inspiration that comes our way, and obviously working still with the guys so that they are, you know, so that when they come along with us, they are very, this is what we did in Hastings, but this isn't necessarily going to be what comes to us in new areas. So it's very much ensuring that there's a very big open space for new things to come along from new men. So hopefully all this community, you know, this relationship at work will lead to more men joining in the conversation around their own health and well-being. And that's not just men, that's anybody who's interested in men's health, that's the communities around them. So that, you know, we're quite fluid around that, but it is primarily on men's health and well-being. And building on what's already working, so spending a lot of time establishing what's already there. We don't want to tread on any toes. It's that, you know, community connection. So you're strengthening community relationships and finding new insights and what matters for men in new areas is kind of key. And again, going back to that cross-area learning, so it's okay, that worked there. Can this approach work somewhere else? What differences? What context? You know, learning about those kind of things. So that's kind of the basis of where we're coming from. Can I have the next slide, please, Sarah? So we started our discovery work. So we spent some time doing some discovery work in Bexhill, and we've been doing discovery walks around the local places and meeting people and chatting and having lots of meetings, doing some networking, having lots of conversations, and we've been mapping the area of what's already available and seeing, you know, where we can go next and finding out what's happening. Very much on that relationship building and coming in, and I'm kind of on the ground level with RVA, and we're doing that together. There's me and another community development worker, and Lindsay, the manager, is kind of working more maybe with services and the wider things that affect men's lives. Can I have the next slide, please? So our connections and relationships, this is just a snapshot of where we're at the moment. Bexhill Men Shed, we're really keen, and they kind of use a similar model. It's all about belonging and men using shared ideas and shared activities to come together. They're really welcoming. Warming Up the Homeless have got a lot of men, so and they're really warm. They're very warm, yes, but they're also very, very supportive and have an appetite for men's work to happen there. DV8, we're really interested in us working with the younger cohort of men and doing some informal sessions with them. Bexhill Library, happy for us to do some work there. Pelham, really, really on board and really wants some things to start happening there. Heart of Sidley, local businesses, talking to board game cafes and places where men might go, local cafes, local restaurants, just thinking where we could pop up, where we could be, where we could put an activity on. And also working with Mind Out, because they've got a bit of funding to go and do some LGBTQ work across Rother, so we're linking in with them as well. Have the next slide, please. So as I said, our co-production is really, really important, and it's kind of what we and collaboration. So these are just some of our core principles and the benefits that happen from working in that way. So again, it's going back to valuing what works, that shared power, openness, trust and respect, and continual learning, reflection. We build a lot of reflection into the work that we're doing. And so we're building on the strengths that are within the community. It's no way, it's not, we're not going to say we can fix you, or it's like, how do we support you? And like it's been said about the neighbourhood mental health teams and all that. So it's being aware of what is available, sort of uncovering some of the fears that people might have about stepping into new spaces, and so sharing what is there already. And mental health is coming up a lot. Suicide awareness is coming up. Housing and homelessness, isolation. So the themes are coming through, and so we're not giving this is what's coming from the community to us. So as we say, success grows when experience leads the way. Next slide, please. I'm being very quick, Sarah. So our next steps are we're now stepping into doing some engagement and delivery. We've already got our film of The Men Don't Talk, and after lots of discussions in Bexhill and Sidley, they think, and we think, and the guys think that that would be a really good tool to show that film, have question and answer sessions around it, just to start new conversations to happen. We've got some venues to start showing that film in, have some answer question, storytelling activities, sharing what matters. We've been exploring a couple of local male storytellers to enable some guys to start telling their stories, so sharing their experiences. There's been an appetite for some men's hour sessions at Warming Up the Homeless, some informal drop-in sessions at the library and at DV8 as well. They'd like that. So it's kind of like starting with the film because we have it, starting with the guys because we've got them, and then seeing what follows on from that. And our project has the ability to support where the energy goes and what may happen next, from talking with men and what matters to them. Men's Shed have asked for us to do some shed talks. We want to do some ripple mapping and theory of change workshops to see what's happening and what's going on, and talk about the theory of change that was developed through the 3 years of the men's work in Hastings. There's an event planned for Mental Health Awareness Week, and we're talking with the Delaware about doing a bit of a soft launch event in possibly May, I think. And we're working on our evaluation and reflection framework, so collecting stories, collecting the important data that shows what conditions are happening when change happens for men, and so we've worked quite hard on that in the background. And we're also working on our governance and stewardship group, with a new cohort of people in the new areas. So that's kind of where we're at the moment. And I will be sharing with everybody when we've got particular dates and times and things that are actually happening. So here's our details, and we would welcome any inquiries and interest in the project from you, anybody who may be interested, because it is about doing it all together and collaborating. And just quickly at the end, I'll just say, I work on this project 4 days a week, and I've now I was successful in some funding from the Awards for All to do 1 day a week, building on the legacy for the Baton of Hope. So there is some work going on from the legacy of the Baton of Hope that happened last year as well. Thank you.
Wow. Wow, Jacy, that's a lot that's going on there. Thank you very much, and thank you for galloping through that. I hope people did sort of have the opportunity to absorb what you were saying. Please get in touch with Jacy if you want to join up. And also I was going to say, just before we go for a 5-minute break, if people want to put their email addresses because they want people to be contacting them, leave messages in the chat for the rest of the meeting if you get time during the break as well. But yeah, we'll go for a 5-minute break. Thank you very much, Jacy. So if we can come back at 11:14, that would be great. Thank you.
this, whatever this is.
Oh yeah, if people could, maybe a few people could just put their cameras on so I know you're back. And yeah, Fenya, if you're there, we'll get started again.
Thank you, Sarah.
Thank
yeah,
you.
as we've been hearing this morning, there's an increasing interest in peer support and community approaches. And with that comes a particular question. What does that actually look like? So today I'd like to share a case study from Eastbourne. Thank you, Sarah. Next slide, please. For 12 years, Compass has focused on creating a community with people who live with severe mental illness and complex trauma. More recently, we've been seeing adults coming who've been reassessed and are identifying with ADHD or autism. And Compass did not set out to design a service. It began with a frontline worker who was watching the same people move in and out of crisis again and again. And she asked a simple question. Is there somewhere my patients could go where they don't fall apart again? She brought that question to Compass, and we opened one afternoon a week for 3 people. No funding, no plan, just a space. Thank you, Sarah. One of the first people we worked with, she wanted to work in an office. She burnt through 3 shredders before she could ask for the support she actually needed. It wasn't employment support. It was basic life support. How to get off a bus when someone sits next to you. How to use a washing machine and not shrink your clothes. How to sew a button back onto a coat. How to say no when somebody keeps asking you for money. How to move through an ordinary day without panic. And that was the moment we realised we were not providing activities. We were holding the conditions that make participation in social life possible. In practice, this is the gap. The gap between services and everyday life. Next slide, please. What happened next was not complicated. People stayed. Some left to try out new things, and some returned when they were close to burnout. They formed relationships that extended beyond our walls. They stabilized, and they wanted their experience to be shared with others. Today, Compass supports around 120 people, with about 60 attending each week. The people who come cannot sustain mainstream services or social environments. The arts are not the intervention. They are a way in, the point of contact, and also a way of leaving diagnosis outside of the door. What keeps people coming is relationship, trust, and belonging. What this creates is a form of prevention that sits outside formal services, but it actually directly affects the demand on them. Next slide, please. So what's actually happening here? Inside Compass, people are taking on roles. 9 people with severe mental illness and 2 people with neurodiversity have completed the NHS peer training. 4 people with lived experience have become supervisors. Alongside the 12 trained facilitators and assistants, this creates a functioning, peer-supported community. There are around 14 activities each week. All are drop-in. There is no pressure to engage. And alongside that, ongoing support, housing, benefits, medical appointments, crisis moments, conflict, and loss. Much of it sits below statutory thresholds, but it is exactly what prevents escalation. This only works because the environment is held carefully. We cannot operate as an open referral service. If too many people arrive in acute distress at once, the community destabilizes. So growth is slow. Trust is built over time. This kind of work is hard to commission, but easy to lose. Next slide, please. Because it may be becoming evident that when a meaningful environment holds, crisis reduces, hospital admissions reduce, suicide risk reduces, people start to support each other. Over the time, this work has generated a depth of insight that is not currently visible elsewhere in the system. And there is no clear route for that learning to inform wider thinking. Next slide, please. So I'm not here to present a new idea. Compass already functions. It is led by lived experience, and it's held by a dedicated team. I'm describing something that is being called for, and in Eastbourne it already exists. A working example of prevention and peer support in practice. But it's fragile. We receive small pieces of project funding, but these do not sustain the core environment that makes this community possible. My team are working at the limits of what is sustainable. Next slide, please. So to close, the history of this work began with a question. So I would like to end with one. If this kind of work already exists, how do we recognise it? And how do we sustain it? And if this feels relevant to your role, I would really welcome a conversation with you. I'll put my contact details in the chat, and I thank you for your time. Thank you.
Thank you, Fenya. Well, that gave us all pause for thought. As you know, I'm a big fan of Compass Arts. I don't know really what to say about the funding situation, but yeah, please do contact Fenya, and we'll keep in touch as well, Fenya. But thank you very much. That was really moving, and I know that you do a great deal for people with serious mental illness and difficulties that perhaps other places can't reach. So thank you.
No, thank you for the opportunity. Thank you.
You're welcome. Okay, so we are a little short of the remaining time. That's my fault. I think I crammed too many items in this earlier this morning, but we're going to talk briefly, and sorry, Jenni, about the suicide prevention side, because this is a shared meeting with our public health colleagues. So shall I hand over to you, Jenni? Are you happy to say next?
Yeah, sure, no problem.
Thank you.
Yes, so still morning everybody. Yeah, Jenni Thomas, I'm the head of public mental health in the East Sussex public health team. Just going to take you through a few slides to give you a bit of an update. We have been reviewing and updating our East Sussex Prevention Action Plan. So basically we've got a 3-year plan. This is the 3rd year that we're now in of the plan, which is evidence informed, focusing on prevention, targeted support, early intervention. Some of the actions are specific for East Sussex. Some of them are a pan-Sussex collaboration with our colleagues in West and in Brighton and Hove. Next slide, please. So one of the areas of the plan focuses on improving data and intelligence. And this particularly focuses really around our use of our real-time surveillance system. So it's notifications that we get from Sussex Police of suspected deaths by suicide. It allows us to obviously see what's going on, to take timely action. If there is a risk that there may be contagion, that we can take action and implement activities to try and mitigate that, and also identify if there's any clusters. So that's obviously a key part of our action plan. Next slide, please. Then we've also got sections of the plan that focus around targeted tailored support for priority groups, and also kind of more population approaches. So under our priority groups, we have it includes these focuses, areas of focus. So men's mental health. So we've done quite a lot of work sort of focused around men's mental health. One of the things to kind of flag at this point is that we do have now a Sussex-wide men's mental health network. So that's obviously not specifically focused on suicide prevention, but it's very much aligned to that. If you don't know about it and you want to find out some more details, please drop me an email. But basically, this is a network where we have reached out to groups in the voluntary and community sector to sort of bring them together, connect them up together so that they can see where they can collaborate, and also just share and signpost between each other as well. You've also heard from Jacy today about the expansion of the work from the Mr Hastings and St Leonard's project. We've also got a focus around priority groups, children and young people. So various bits of work going on there. There's a toolkit and guidance around self-harm prevention, training, and also the Sussex toolkit for unexpected deaths in schools, which has been rolled out. We've also got our whole school mental health approach, linking in with mental health support teams in schools. At the moment, we are in the latter stages of completing a mental health needs assessment for older people, and also an audit rather of older people's suicides, and there will be a series of recommendations and actions arising from the completion of both of those pieces of work. And also linking in with our Safer East Sussex team, we have within the action plan a focus around domestic abuse, and implementing strategies and learning from our domestic abuse related deaths reviews. And we have also already commissioned and had delivered some suicide prevention training in the context of domestic abuse, and in collaboration with colleagues in West Sussex, we are hoping to do some training, domestic abuse perpetrators suicide prevention training later on this year. Next slide, please. In terms of sort of population level and early intervention, we've got various pieces of work that are going on. So some of you will be aware of the Connected People and Places stewardship approach to loneliness work that has been taking place and is expanding. Linking in with our colleagues in adult social care, there's the read across to the financial inclusion steering group and recognition that the financial element and burden that can place on people. So linking in with that work. Emerging work, which I've spoken about briefly before, but is definitely gathering momentum, is the work around prevention of gambling harms, recognising that there is a strong associated risk between those who are gambling at high levels and the risk of suicide. So one of the pieces of work that we'll be doing this year is undertaking a gambling health needs assessment that will inform our future strategy around that, and also linking across to all of the work that's going on around alcohol. Next slide, please. So yes, in terms of online safety and comms, various pieces of work. I think Sarah is going to mention about the suicide prevention communication subgroup that's going to be established as a subgroup of the mental health comms working group. That will be a pan Sussex piece of work. And also we do have our warning signs website, which is particularly focused around men's mental health and suicide prevention. One thing that's missing from this slide is also that we are doing work around promoting the Safe from Suicide guidance amongst those in helping roles, which is the NHS guidance that has come out, best practice guidance for safety assessment and management. Next slide, please. I think I'm nearly there. We've also within the plan got a focus around bereavement support, so that's working with partners to ensure the continued delivery of that support to those who have been bereaved by suicide, and also at our next meeting of this group, my colleague who led on this workforce wellbeing project will be coming along and telling you about that. But in short, we did, and some of you hopefully participated in a series of training around basically making sure that those people who are working in areas where they may come across people who have either been bereaved by suicide or have had suicidal ideation and are exposed to distressing material, that there is support for those in terms of kind of preventing the risk of vicarious trauma. Next slide, please. We've also got our work that we focus on around safer places. So our coastal suicide prevention programme is first sort of front and centre to this work. We are also co-chairs of the Safer Public Spaces Network, which is a national network which focuses on frequently used locations. So we link in with colleagues across the UK to share learning and to share best practice. We're also doing, obviously we've got our training programme, and we try to ensure that there is access to freely accessible training around suicide prevention and mental health. And one area that we know we need to do better is really linking in with those with lived experience. So as part of the suicide prevention comms subgroup, I'm keen that we do have people linking in with lived experience into that, but also into lots of this other work that we're doing. Next one, please. So just very briefly, so that was the Suicide Prevention Action Plan. Just very briefly, a few other updates sort of in the field that we're working on. I mentioned our coastal suicide prevention work. We are having a series of workshops from April through to July to kind of bring together our stakeholders and our partners to look at refreshing our action plan around that. It remains an ongoing challenge for us in East Sussex. In terms of gambling prevention harms, some of you will be aware that there's now a national levy that's come into place. The funding for that has been very slow in coming through, but we should be hearing this week or next week the allocation of funding that we will be getting from OHID to focus on that prevention work. Our Beachy Head Ambassadors project has been extended, which is really great. Some of you will be aware that of the Beachy Head Ambassadors and the way that they are helping to change the narrative and the perception of that area and to really focus on its health and wellbeing benefits and the beauty of the area. They are open for more volunteers to join them, and that's open until the 31st of March. So please do promote that through your networks. And finally, we have a mental health prevention group that has been doing some work that's focused around trauma and also peer support. And there are plans to merge that group and the Sussex Suicide Prevention groups together, recognising that there's quite a lot of commonality in the focus of both of those groups. So more details to follow on that. Thank you.
Well, Jenny, you came well under.
Oh, good.
You absolutely galloped
time
through
back.
that. So I don't know if anyone, sorry, I shouldn't have asked you because actually we were doing okay in the end. So has anyone got any questions for Jenny on any of those things she's absolutely torn through this morning? So there's the older people's needs assessment, domestic abuse, men's mental health, loneliness, gambling harms, the coastal suicide piece, and safer spaces. Actually, I've got a question about safer spaces. What is that? What's that about?
So it's a national network of mainly public health teams, but not exclusively, of people who have locations in their area where there are frequent incidents or cases of deaths by suicide or people going to places with suicidal ideation. So it may be places where they've got bridges. They may be places who've got coastal locations. It might be a rail network, stations with busy rail networks. So so it's a national network where we come together and we share what we're all doing to try and address the challenges that we're facing with our frequently used locations. So it's we're now looking to extend that out to also bringing in experts and people from international locations as well. So it's really helpful to be able to share the challenges that we all face and to, as I say, kind of share best practice, be it around signage or support for those who are working in those areas. So yeah, it's a network. It's been going a couple of years now, but the hosting of it is now being taken over by the National Suicide Prevention Alliance. So I think its focus and sort of visibility will be greatly enhanced by that association. So that can only be a positive thing.
Okay, and then the only other thing I was going to mention was the suicide prevention groups. You've called them groups, but I think you mean the steering group. Is that for East Sussex?
Yes, sorry, yes. I've messed
Yes.
off the word steering group. Yes.
No,
yes.
it's fine. It's just that I didn't know also if that was open to new members.
Yeah, I mean, as I say, there's a discussion about merging those two groups, and as part of that, we'll obviously create new terms of reference and also review the membership of that.
Okay, thank you. Has anyone else? Oh, James, you've popped your hand up.
I just popped my hand up. Thanks, Jenny. That was really interesting. I was just wondering, in terms of the training you mentioned around suicide prevention in the context of domestic abuse, I was just wondering if there's anything available at the moment. I heard you were linked in with the Safer East Sussex team anyway, so it might be covered. But obviously, we've got the Interventions Alliance organisation who've taken on the MCN refuge and are providing support in the community, and I think they've taken on all the refuges in East Sussex, and just links around that maybe.
Yeah, absolutely. I mean, to be completely honest with you, our existing contract for training provision is coming to an end at this month. So we're doing a bit of a review to kind of just reassess what training we think is still, that's not the right word, but is most useful. And I think some of that more targeted setting specific training is probably the route that we're going to go down. So there's that in terms of the domestic abuse, yeah, that's very much front and center, that we want to do more of that training and give people the skills to know how to, you know, to support people and have those conversations. So yeah, very much so.
Thank you.
Okay, thank you. Right, well, the next item is mine, so I will try and gallop through it. So I spoke to you last time about the mental health communication. So this is a group that's been meeting across Sussex with all sorts of people across the system and some lived experience. So in 2025, last year, we considered how to reach particular groups. So people who weren't online, people who didn't have English as their first language, and people who are neurodivergent. So that's still happening. So in 2026, we, as Jenni mentioned, we're establishing 3 different working groups with a different focus for each one. So the first one is suicide prevention. I don't know if you want to say anything about this, Jenni, but you're one of the co-chairs with Rachel from Grassroots. Did you want to speak to this slide?
Yeah, sure. So yeah, we've been meaning to kind of set up a kind of a Sussex-wide communications group around suicide prevention for some time. Yeah, we need to identify where are the areas of kind of common focus. So that doesn't mean that each area is not going to do, you know, if they've got a particular priority group that they want to focus on, that they can't do that. But there are some areas in common, and I think probably in the first instance, we will kind of coalesce around the World Suicide Prevention Day in September, but then also think about the ongoing areas of priority and how best to utilise, you know, our kind of our you know, come together to coordinate consistent comms that will be also consistent with this wider communications that's already taken place. So people will be aware of the How Are You Really Feeling campaign, and we would be looking to build on that and make sure that there is that kind of that read across and consistent way of communicating.
Yeah, so these 3 groups will obviously complement each other. We'll be collaborating, making sure there's read across, but it was felt that these 3 themes warranted their own groups. So yes, firstly, the suicide prevention. Then we've got mental health prevention, which is a funny phrase. It means to keep you well, obviously, and the promotion of our services. So again, we'll continue from the How Are You Really Feeling campaign and just think about how we can have hooks to take the campaign forwards, think about different groups that we haven't reached yet, and also think about, like Jenni says, our local populations. So I'm going to co-chair that with Brooke from UOK Brighton and Hove. So it's Pan Sussex, but we will be focusing down as well. Then we've got the perhaps more inward looking in terms of the system. So the third group is the primary care engagement comms group, because staff working in the system need to understand the system. So a lot of that is about making sure that people who work in GP surgeries and GPs themselves are aware of the new developments, the neighbourhood mental health teams, and so on. So that's being chaired by Rachel Jevons and somebody from the Alliance for Better Care. That's what's been suggested to date. So I think we've got our first meeting. It's when I'm on holiday, but we're to discuss how we take it forward and some of the the starting point really. But if you're interested in those groups, you know, please drop me a line, or Justine, I can put her email into the chat as well. And then in terms of what's still happening, we've still got, I've sent out an email, so I won't elaborate too much, but we've still got hard copy materials, which there is a budget to be posted out to you. So you can just drop them an email, say roughly how many leaflets or posters you would like, and they will be dispatched to your team or wherever you want them. So that's brilliant. And also I've put in there's those particular languages that were felt to be the most prominent. We do know there are other languages, and I suspect we'll be thinking about that going forwards. So yeah, please keep in touch about that, because I think it's quite rightly an ongoing campaign. And then lastly, but not least, we've got the partner information exchange. Sarah, did you want to, you're the expert here, you're leading on this, the VCSE Mental Health Network
Hello,
update.
yes.
Hi.
Thank you. So mainly what we've got going on at the moment, we've been really looking at prevention. So there's a lot of things we'd like to share at the next network meeting, following on from the in-person one we had in January. We're putting together a report about prevention and the VCSE network, and what that means to people. So we've done some feedback, and we've done some interactive sessions in the last meeting. So if you're interested in hearing more about that, please do come along to the next network meeting, and that's online, and there's a link there to add to your calendar. If we're sort of collecting case studies at the moment to sort of like help build this narrative around what the VCSE sector sees prevention as in for mental health. So if you're interested in supporting or being involved, please do reach out. I'm happy to have conversations with people. So those are the main bits going on, and we're sort of in the process of putting together our schedule for the year ahead. So we did a bit of an annual survey, so we're still sort of putting that together at the moment. But if you're interested in being involved in any webinars or events, then please do reach out, and we'll be happy to work with you. Okay, that's very brief. There you go. Thank you.
That's brilliant. Thank you. Lots going on, and not just for people in VCSE, actually. They're really useful events and things. So thank you very much, Sarah. I just wanted to put this in here. I'm sure people do know, but just to say a big thank you to Jacy and all of her staff and people who've been involved in Ezra over the years. You know, it's with great sadness that they're closing at the end of this month. So I just wanted, just been very amazing and gracious about it all. And then this was the last thing I wanted to include. This has been out for a little while, but I don't think I'd shared it before. So if you want something to listen to while you're having your lunch, there's some podcasts, they're like podcasts, living histories that have been produced by the Trust, the Mental Health Trust, which are people with lived experience of mental health services, particularly inpatients, people with long and enduring mental health conditions, which is really good. It just gives you an insight about what it's like to experience that within your life. Okay, is there anybody else that has got anything else they would like to share? I didn't have anything else come in by email. Ricky.
Hello, yeah, just a quick one, Sarah. Great meeting. It's the monthly co-production forums, following from the conferences that we do every year. Our next monthly forum will be on April the 1st, and I'll put all the details in the chat if anyone wants to join that.
Great, thank you, Ricky. Peter.
Hi everyone. It was just a quick one to let you know that Mind in Brighton and Hove are moving offices and our new registered address as part of that. So I'll put it in the chat. And Sarah, I've sent you an email as well, if it's possible to send that out across the group as well.
Will do. Thank you very much. Thanks, Peter. And Fenya.
Thank you. 31st of March is Trans Day of Visibility, and our peer-led group Queer Roots will be hosting a drop-in for anybody who would like to come and meet and do some activities at the Gather in the Beacon in Eastbourne. That's the 31st of March. And we have just received some funding because we have a group of men with SMI who also want to now develop a group here in Eastbourne. So if anybody wants to get in touch about that, it'd be lovely to hear from you. Thank you.
Lovely. Thank you, Fenya. Can you tell me the timing for the drop-in, the Trans Day of Visibility? You said 31st of March.
Yeah, it'll be 10 till 5.
10 till 5.
Thank
Fantastic.
You.
Thank you so much. Okay, I can't see any other hands, so it's your last chance. Gone. Okay, lovely to see everybody. I will share this, the recording, so you can share it with any colleagues or anyone who might be interested. Thank you all so much for what you're doing, and yeah, keep in touch. And thank you to all the speakers again. You've been absolutely brilliant today. Have a good rest of the day.